Picture this. You're standing in your kitchen, reaching for what you think is a healthy snack. Maybe it's something you've eaten for years, something your doctor even recommended for your heart. But what if I told you that this seemingly innocent choice could be quietly fueling prostate problems that are stealing your sleep, weakening your stream, and draining the vitality right out of your life? I'm Dr. Lila Romano, and I've been a practicing urologist for over a decade. In my clinic, I've seen hundreds of men in their 50s, 60s, and beyond who are frustrated, exhausted, and confused about why their prostate health keeps declining despite doing everything right. And time after time, when we dig into their daily habits, we find the same culprits hiding in plain sight, foods marketed as healthy that are actually working against them. Today, I'm going to cut through the confusion and give you the truth about nuts and seeds. I'll reveal the 4 common ones that are actively inflaming your prostate and making your symptoms worse. Then I'll share the 4 powerful allies that can calm that inflammation, strengthen your urinary flow, and support long-term prostate health. For each one, I'll explain exactly how it works in your body and give you a clear action plan you can start using today. Before we dive in, if you're serious about taking control of your health, hit that subscribe button and turn on notifications. And let me know this information is valuable by typing yes in the comments if you find this helpful. Your feedback helps me create content that truly serves you. Now, let's start with the troublemakers, the 4 nuts and seeds you need to recognize and limit. Destroyer number 1, peanuts. Let's begin with America's favorite nut, except it's not actually a nut at all. The peanut is a legume, and for aging prostates, it's a problem disguised as convenience food. Here's what most men don't know. Peanuts are susceptible to a toxic mold compound called aflatoxin. This toxin accumulates during storage, especially in cheaper brands and bulk bins. Aflatoxin puts tremendous stress on your liver, and your liver is responsible for clearing excess estrogen from your body. When that process slows down, hormonal imbalance follows, and that imbalance creates the perfect environment for prostate inflammation and abnormal cell growth. But that's not the only issue. Peanuts are loaded with omega-6 fatty acids. Now, you need some omega-6, but the modern diet already provides far too much, especially compared to omega-3 intake. This creates a ratio problem that drives chronic, low-grade inflammation throughout your entire system. That inflammation doesn't just cause general discomfort, it directly aggravates the prostate, contributing to enlargement and worsening urinary symptoms like frequent nighttime bathroom trips and weak flow. And if you're eating salted, roasted peanuts, or conventional peanut butter, you're adding even more fuel to the fire. The excess sodium in processed peanut snacks has been directly linked to more severe urinary symptoms. Some commercial peanut butters also contain partially hydrogenated oils, a source of trans fats that spike inflammation even further. I had a patient, a 61-year-old contractor, who came to me exhausted from waking up 4 times every night. His blood work showed slightly elevated liver enzymes, which caught my attention. When I asked about his diet, he mentioned eating peanut butter on toast every single evening. We made one simple swap, almond butter instead, and added an omega-3 supplement. Within 5 weeks, his liver markers normalized, and he was sleeping through most nights again. His energy came back, and so did his confidence. If you love peanuts and can't imagine giving them up completely, here's what I recommend. Make them occasional, not daily. Choose organic Valencia peanuts, which have lower aflatoxin risk. Avoid anything with added sugar or hydrogenated oils. And always balance peanut consumption with omega-3 rich foods like salmon, sardines, or ground flaxseed. But honestly, if you're already dealing with prostate or urinary issues, other options will serve you better. Destroyer number 2, sunflower seeds. Next up is a snack that feels virtuous, sunflower seeds. They're crunchy, protein-packed, and often included in heart-healthy trail mixes. But for prostate health, they're quietly problematic. The core issue is their extraordinarily high omega-6 content, particularly linoleic acid. When your omega-6 to omega-3 ratio gets out of balance, which it almost certainly is if you're eating sunflower seeds regularly, your body shifts into a pro-inflammatory state. This systemic inflammation affects everything, including prostate tissue. It can accelerate tissue growth, disrupt hormone regulation, and create an internal environment where cells don't behave normally. The result? Weak urine flow, urgency, incomplete bladder emptying, and those dreaded middle of the night bathroom trips. And if you're eating the salted, roasted versions sold in grocery stores, the added sodium compounds the problem by irritating the urinary tract and raising blood pressure, both of which make symptoms worse. I worked with a 59-year-old electrician who snacked on salted sunflower seeds throughout his workday. He described his stream as frustratingly weak and stop-start. We replaced his seeds with unsalted pumpkin seeds and added more fatty fish to his diet. Within 3 weeks, he reported noticeable improvement, stronger, more consistent flow. His blood pressure also dropped slightly, which likely helped reduce strain on his entire urinary system. If you crave something crunchy, reach for a small handful of raw almonds or dry roasted. Pumpkin seeds instead. Keep portions modest and make sure your daily diet includes omega-3s to counterbalance any omega-6 intake. Destroyer number 3, coconut. This one surprises people. Coconut products, shredded coconut, coconut oil, coconut milk, have been marketed as miracle foods. But when it comes to prostate health, science tells a very different story. The problem is coconut's extremely high saturated fat content. Large-scale research, including data from the Physician's Health Study, has repeatedly linked high saturated fat intake with increased risk of both benign prostatic hyperplasia and aggressive prostate cancer. Here's the mechanism. Saturated fats activate inflammatory pathways in your body, particularly one called NF-kappa B. Once activated, this pathway keeps inflammation running continuously. That ongoing inflammation increases activity of an enzyme called 5-alpha reductase, which converts regular testosterone into a much more potent form called DHT, dihydrotestosterone. Elevated DHT levels stimulate prostate cells to multiply faster, leading to enlargement and worsening symptoms. There's another layer to this. Coconut is extremely calorie-dense, and it's easy to consume a lot without realizing it. Those extra calories often translate to weight gain around the midsection, and abdominal fat is metabolically active. It produces inflammatory compounds that make prostate problems worse. One of my patients, a 64-year-old architect, was adding coconut oil to his morning coffee and snacking on coconut chips daily. His PSA levels were creeping upward, and his urinary hesitancy was severe. We swapped coconut oil for extra virgin olive oil and replaced his chips with almond-based snacks. Within a month, his PSA stabilized, and he reported significant improvement in his sense of bladder fullness and hesitation. If you enjoy coconut, save it for rare occasions, a treat, not a staple. For everyday cooking, choose oils rich in monounsaturated fats like extra virgin olive oil or avocado oil. These support healthy hormone balance and actually reduce inflammation. Destroyer number 4, cashews. The final destroyer is deceptively mild, the cashew. It's creamy, palatable, and socially acceptable. You'll find it at every party, in every trail mix, on every salad bar. But its very ubiquity is what makes it dangerous. Men eat cashews mindlessly, in large quantities, and those handfuls add up fast. Cashews contain palmitic acid and moderate levels of saturated fat, the same inflammatory fats found in coconut. These fats activate NF-kappa B pathways and can increase 5-alpha reductase activity, driving up DHT levels and accelerating prostate growth. But the bigger problem is caloric density. A few handfuls of cashews can contain 300 to 400 calories, and most men dramatically underestimate how much they're eating. The resulting weight gain, especially around the waist, fuels systemic inflammation and is strongly correlated with worsening prostate symptoms. There's also the copper factor. Cashews are extremely high in copper, and while copper is an essential mineral, excessive amounts may contribute to oxidative stress and hormone imbalance in some men. I remember a patient in his late 50s who ate large salads daily, but drowned them in rich cashew-based dressing. Despite eating healthy, his urinary urgency wasn't improving. We simply swapped that dressing for a lighter tahini lemon option. Without any other changes, He lost 7 pounds in 5 weeks and reported a dramatic reduction in urgency and frequency. The hidden inflammatory and caloric load from the cashews had been holding him back the entire time. If you enjoy cashews, limit them to a small handful 2 or 3 times per week. Choose dry roasted, unsalted varieties and avoid flavored or candied versions entirely. I know that list might feel overwhelming. You might be thinking, is everything I enjoy off limits? But here's the truth. What I've just shared is only half the story. The other half is where the real power lies. Because for every food working against you, there's one working just as hard in your favor. So let's shift gears and talk about the 4 prostate healers that can transform your health. Healer number 1, pumpkin seeds. If I could recommend just one food for prostate health, it would be pumpkin seeds. These small, unassuming seeds are packed with compounds specifically designed to support the male urinary system. The star player is a group of plant compounds called phytosterols, particularly beta-sitosterol. Beta-sitosterol gently inhibits that same 5-alpha reductase enzyme I mentioned earlier, the one that converts testosterone to DHT. By reducing that conversion, pumpkin seeds help slow prostate growth and ease urinary symptoms. Clinical studies have shown that beta-sitosterol supplementation improves urine flow and reduces residual bladder volume. Pumpkin seeds also deliver a powerful package of anti-inflammatory nutrients, vitamin E, magnesium, zinc, and polyphenol. These protect prostate tissue from oxidative damage and support the smooth muscle function that controls urine flow. Zinc is particularly important. Your prostate stores more zinc than almost any other organ in your body, and maintaining adequate levels is critical for healthy prostate function. You don't need much. 1 to 2 tablespoons of raw or dry roasted, unsalted pumpkin seeds daily is plenty. Store them in an airtight container in the refrigerator to preserve their oils, and skip salted or flavored varieties. Timing matters too. Evening is ideal. A small serving of pumpkin seeds can stabilize blood sugar overnight and may help reduce nighttime bathroom trips, especially if you pair them with a protein source like Greek yogurt. Healer number 2, almonds. Almonds are a urologist's dream food. They're rich in monounsaturated fats, the same healthy fats found in olive oil, that actively reduce inflammation, support healthy blood pressure, and improve cholesterol profiles. Better cardiovascular health means better pelvic blood flow, and that translates directly to improved urinary function. Almonds are also nutrient-dense. Magnesium supports nerve and muscle function, including pelvic floor nerves involved in bladder control. Vitamin E reduces oxidative stress that can damage prostate tissue. Riboflavin supports cellular energy production, keeping you from feeling sluggish. And manganese plays a role in maintaining healthy connective tissue and circulation. Together, these nutrients reduce pressure on the prostate, improve vascular tone, and support overall pelvic health. The ideal serving is about 20 to 23 almonds daily, roughly 1 ounce. Choose raw or dry roasted, unsalted varieties. Avoid honey roasted or candied versions. Pairing almonds with berries or apple slices helps keep blood sugar stable, which further supports hormone balance and reduces inflammation. One of my patients, a 62-year-old with type 2 diabetes, made almonds part of his morning routine. Not only did his blood sugar control improve, but his urinary hesitancy, that frustrating delay before flow starts, virtually disappeared within 2 months. Healer number 3, soy foods. I need to address the elephant in the room, soy. There's massive confusion and fear around soy for men, but the science is crystal clear. Whole soy foods are protective for prostate health, not harmful. The key is understanding how soy works. Soy contains isoflavones, particularly one called genistein. These are phytoestrogens, but they don't work like human estrogen. Instead, they bind preferentially to a specific receptor in the prostate called estrogen receptor beta. When they bind there, they send an anti-proliferative signal. They tell prostate cells to slow down growth and can even promote programmed cell death in abnormal cells. Isoflavones also affect angiogenesis, the formation of new blood vessels that tumors need to grow. By limiting this process, soy helps create an internal environment less favorable to disease progression. And here's what many men worry about. Will soy lower testosterone or cause feminizing effects? The answer, according to dozens of studies, is no. Moderate soy intake keeps testosterone and estrogen in healthy balance without adverse effects. In fact, populations that consume more soy have lower rates of prostate cancer and fewer severe urinary symptoms. Beyond hormone effects, soy provides high-quality protein and fiber, both of which improve weight control, blood pressure, and cholesterol, all factors that influence prostate and bladder health. You don't need a lot. 2 to 4 servings per week is sufficient. Good options include steamed edamame, firm tofu in stir-fries, tempeh in salads, or unsweetened soy yogurt. Choose minimally processed soy and avoid sugary or fried products. I worked with a patient concerned about his family history of prostate cancer. He added steamed edamame to his weekly routine. At his follow-up, his PSA levels had not only stabilized, but showed a favorable downward trend. The peace of mind that gave him was invaluable. Healer number 4, flax seeds. Finally, let's talk about flax seeds, the richest dietary source of lignans, another class of beneficial phytoestrogens. Like the compounds in soy, lignans help your body process hormones more efficiently. They reduce 5-alpha reductase activity, lowering DHT production and slowing prostate growth. This creates a calmer, healthier environment inside the gland. Flax seeds are also loaded with both soluble and insoluble fiber, which supports gut health. A healthy gut microbiome plays a bigger role in prostate health than most people realize. It influences hormone metabolism, inflammation levels, and even how your body processes nutrients. Flax also provides a plant-based omega-3 fatty acid. Combined with fiber and polyphenol, this creates a powerful anti-inflammatory effect that reduces irritation and discomfort throughout the urinary tract. The key is consistency. 1 to 2 tablespoons of ground flaxseed daily is ideal. Grinding is essential. Whole flax seeds pass through your digestive system intact, and you won't absorb the nutrients. Grind them fresh weekly and store the ground flax in the refrigerator or freezer. Add ground flax to oatmeal, yogurt, or smoothies. Its mild, nutty flavor pairs well with berries or cinnamon, and it's best added after cooking to preserve beneficial compounds. One gentleman in his late 50s came to me frustrated with weak stream and post-void dribbling. He added 2 tablespoons of ground flax to his breakfast daily. By week 4, his urine flow felt smoother and his urgency had noticeably eased. When we checked his cholesterol at his next visit, his LDL had also improved. Now, I don't want you to feel overwhelmed by all this information. The key to success is building a simple, sustainable rhythm. Start by incorporating one healing food daily and rotating them throughout the week. A tablespoon of pumpkin seeds can become part of your evening routine. About an ounce of almonds, roughly a small handful, makes a perfect mid-morning snack. 2 to 4 servings of soy-based meals spread across the week add protective isoflavones. And 1 to 2 tablespoons of ground flaxseed stirred into breakfast keeps hormones balanced and inflammation low. As for the destroyers, reserve them for rare occasions. When you do have them, choose unsalted, dry-roasted versions without added oils or sugars, and watch your portions carefully. Storage and preparation matter. Buy raw or dry-roasted nuts and seeds without industrial seed. Oils. Keep pumpkin seeds and ground flax in airtight containers in the fridge. Grind flax only once a week to keep nutrients active. Check for freshness by smell and taste. A bitter or stale flavor means the oils have oxidized, and it's time to toss them. A few safety notes. If you're taking blood thinners like warfarin, check with your doctor before increasing flax or soy, as they can interact with these medications. Anyone with nut or seed allergies should monitor for reactions carefully. And if you have liver issues, avoid peanuts entirely due to aflatoxin risk. Here's what to expect. In the first 2 weeks, you'll likely notice smoother digestion, more stable energy, and reduced salt cravings. By weeks 3 to 6, many men report fewer nighttime bathroom trips, stronger urine flow, and better mornings overall. Between weeks 8 and 12, you may see measurable improvements, shrinking waistline, better cholesterol, numbers, and more reliable urinary symptoms. To make this even easier, Follow this simple 2-week starter plan. Week 1, swap peanuts or sunflower seeds for almonds. Add 1 tablespoon of ground flax to breakfast. Sprinkle pumpkin seeds on your evening snack. Replace coconut oil with extra virgin olive oil in cooking. Week 2, increase flax to 2 tablespoons if you're tolerating it well. Add 1 or 2 soy-based meals, like tofu stir-fry or edamame. Rotate between almonds and pumpkin seeds for variety. Pay close attention to changes in bathroom frequency, energy levels, and urine flow. Every single choice you make sends a powerful message to your body. Choosing healing foods isn't just about managing symptoms. It's about protecting your strength, your independence, and your quality of life as you age. This information is too important to keep to yourself. Share what you've learned with a friend, a brother, or your son. Open conversations about prostate health help all men stay healthier and more confident. If this video provided value, I'd be honored if you'd subscribe to the channel and hit that notification bell. Let me know your thoughts by typing yes in the comments if this was helpful. Your feedback truly guides what we discuss next.